Hi everyone, Jodie Ann Senior here, cardiologist, heart failure specialist. We're here to talk about heart failure topics that are going to be hopefully helpful to you. So today's topic is salt and whether or not it's a good thing, a bad thing. What do we really know? What's the recommendation around salt in heart failure? So I was having a bit of a browse of a Harvard Health blog, and it was discussing the role of salt and heart failure and what evidence we have to support our recommendations. And most of us do recommend low salt diets, but there have been a number of studies over the years, small, not sort of robust evidence around this argument about salt. And salt is linked with potential for an increase in water retention and fluid, which is something we don't want in heart failure, but it's also related to raised blood pressure. And so both of those things are not helpful often in heart failure patients. And when you think about it, there's probably somewhere in the vicinity of 26 million heart failure patients worldwide. In the US, in America, there's around about 6.5 million patients. In Australia here, it's around about 110,000. So there's a lot of people's diets to consider. And essentially we've recommended avoidance of salt in general, certainly additional salt to foods, but you also have to think about high salt foods, whether it be sardines or really salty kind of fish, whether it's salty foods. Highly processed foods often contain a lot more salt than natural sources of food, fruit, vegetables, things like that. Then it's more the added salt. So you do have to sort of look at that and think about that. But what's the evidence behind this? Well, the recommendation is around about to keep your salt intake to less than 2 grams of salt per day, or 2,000 milligrams of salt per day, which could be quite hard to do depending on what your diet consists of. Though we can all, stop adding salt to our diet. What are the kinds of things that we are eating? This then raises the question of, whether or not it's the salt and high salt diets, or is it the kinds of foods that we are actually eating which contain that high salt. So for example, if you are having hyperpalatable foods and that's a large part of your diet with high salt, high fat and high sugar content, then those things are likely to negatively impact you in terms of your weight gain, weight control. If you are diabetic, that could be a further issue. So some of that negative outcome may actually be as a result of the types of foods that you would be eating to have a high salt diet. In 2018, there was a systematic review in JAMA Internal Medicine that looked at a series of 9 studies that were looking at this question regarding salt and heart failure and whether or not this was a good or a bad thing. The outcome of looking at those studies, there was around about 479 patients who had heart failure. The difficulty was the level of evidence, the robustness of that evidence, and the consistency amongst the studies. It's hard to look at patients and diet as a factor because we're not lab rats. We have huge variety in the way we eat, what we eat, when we eat, how we exercise. So it's very hard to actually make that uniform and consistent and then make sense of what you're actually finding. Whereas if you're a lab rat studying diet and whatever exercise a lab rat would do, that's much easier to control for, much easier, less variables, and therefore you can get more consistency in terms of determining the outcomes. they were looking at things like, did you actually get a positive result that that showed, say, a patient had a better functional class, which means that they could actually breathe easier and do more, exert themselves more without breathlessness as a result of a low salt diet versus people who had average or higher salt diets. And a couple of studies showed, yes, there was a benefit. A couple of studies showed, no, there wasn't really a benefit, or were neutral. So I think the bottom line is we don't have clear-cut evidence for our guideline direction of a low-salt diet. I think it's safe to say in my practice, I don't get too tied up in the nitty-gritties. I tend to, in fact, try and guide through more common sense approach, try to avoid high salt intake, notice whether or not that makes you retain fluid and weight and water over the following 24 hours, or whether there's not much of a difference, and be a bit guided by that. Try and be sensible with it. Try to avoid those hyperpalatable foods where possible, because those are potentially detrimental to our health in many respects, not just with regards to the heart failure condition itself, but in particular diabetes and weight control. The more weight you're carrying, the higher the workload to do anything. So, that's also an important thing to consider. The more you stick to whole foods, the more you stick to natural sources of foods rather than ultra-processed foods, then potentially the better off you're going to be. Okay? We will see you next time.